As we've gone farther into the free market healthcare movement, we've really just had a lot of value added to our plan with all of the partnerships we've made.
One handshake in this room in the next 24 hours could absolutely change my course in our pathway for what we do.
I've learned a lot at this conference, and there's things that I'm hearing that we need to put into our health plan.
You've seen 3 people up here present that they've reduced total cost of care by improving care for patients.
We're going to improve the lives of your employees, and we're going to make their raises meaningful. We're going to reduce their out-of-pocket costs, and we're going to make your employees' lives better.
We just did it so much better that most of his employees have now engaged with us.
So she had a fantastic experience, and we saved the employer somewhere between $35,000 and $45,000.
You're talking about organizations that are capable of undercutting the pricing of the existing healthcare system very dramatically.
There are so many people who would be best served by systems like that.
Typically, we don't pay less and get more. It just doesn't work like that, right? But this is a scenario where we do.
If you can help people get better care for less money, that to me is a heroic effort.
I think in today's labor market, that's a really important thing to think about.
For me, it's about having a healthcare plan that I'm not embarrassed when we're trying to recruit and retain talent.
It's really helped our recruiting during this challenging time for those of you who are having fun trying to find employees.
And patients loved it. Doctors loved it.
This is actually happening. We're putting this into practice. We're putting this into people's lives. We're making an impact.
This is not proof of concept stage anymore. I mean, we are way past that.
The value proposition of the big buka carriers in today's world is really in limbo.
The market is really very innovative right now. It's very dynamic. I've never seen it move as fast as it's moving today.
You can't stick old school stuff into these healthcare plans and get the desired results.
We saved them $1.76 million. That's a 41-to-1 ROI, not a bad day at work.
Her out-of-pocket costs went to zero.
We did it for probably 40% of what it would have cost.
At that moment, I figured out that's the way to go.
As this movement spreads, we all win.
One of the goals we all in this room are promoting is this expansion of a free market system, of an ecosystem.
That makes you better off and it makes the patient better off. That is creating value. And value, ladies and gentlemen, cannot be faked. Thank you very much.